Welcome everyone to this Family Medical Education webinar provided by the Family Medical Coping Initiative at Boston Children's Hospital, and we are so glad that you're joining us today. The Family Medical Coping Initiative is a program through the Hale Family Center for Families at Boston Children's and a multidisciplinary effort spearheaded by psychology, social work, and child life. The program was developed to provide education to families and to staff about ways to enhance child and family coping with the impact of children's medical conditions, medical procedures, and other interactions with the healthcare environment. And today's webinar is presented by the Family Medical Coping Initiative team. I'm delighted to introduce my colleagues, Dr. Elisa Bronfman, who is a psychologist who's been working with medically ill children at Boston Children's for 25 years, and Gail Windmueller, a certified child life specialist who's been at Boston Children's working with a wide variety of patients and families for more than a decade. And I'm Annie Banks. I'm a social worker in the Hale Family Center for Families, and I've been working with families in medical settings for more than 30 years. So I'm going to be monitoring your questions in the chat today in the Q&A. Please feel free to send along any questions during the presentation or during the question and answer period at the end. And we may not be able to answer your questions about your individual child's circumstance, but we welcome general questions about the topic. And if we don't get to all of your questions here today, we'll follow up with you via email sometime after the presentation. That might take a little while, but we will get to you. Also, this presentation is being recorded, and a link to the recording will be sent to you within several days of the presentation. So we'd also like to note that we are offering a lot of information in today's presentation. Please remember that you will receive the recording of the webinar if there are pieces that you'd like to review. And there is a booklet about how to swallow, teaching your child how to swallow pills that can be accessed in the webinar. There'll be a QR code on one of our slides. You can take a screenshot of it, but use your phone to use that QR code to have access to that. And we hope that that's helpful to you. And now, let's begin, because we have a lot to cover. So what we're going to talk about today: the importance of finding ways for children to take medicine more easily, common issues children have when needing to take medicine, helping your child think differently about their medicine, which makes a big difference, strategies to help your child, including infants, take liquid or chewable medication, and a step-by-step approach to teaching your child how to swallow pills. And then, of course, we'll have the QR code, as I said, on how to access the Family Medical Coping Initiative Pill Swallowing Guide. So the importance of taking medicine as recommended. Of course, we know not taking medicine as recommended by your child's healthcare provider can result in some pretty difficult things. Of course, worsening health problems, sometimes needing to spend time in the hospital when your child would rather not be there, and you too. Taking a longer time to feel better if the child isn't taking the medication properly, and of course, increasing stress on the whole family. When a child has a condition and they're not taking their medication, it can upset everything in the family as a result of that condition. So in contrast, taking medications as instructed, of course, can result in better medical outcomes, fewer complications for the child and the family, and establishing long-term habits that support health into adulthood. So we know that it is often hard to get your child to take their medicine. I will say to all of you, I have been there. And parental desperation about getting your kid to take medicine can be really tough, and sometimes can lead to some very unhelpful methods. Some unhelpful things are telling your child it tastes like candy. First of all, that is often not true, and can lead to a child sneaking the medicine and risking a very serious overdose. Also, taking some of your child's medicine in front of your child if it's not your medication, right, you're taking their medication, it can make them think it's okay to take other people's medication. You might think it's good modeling, but it really confuses them. Certainly there is fighting or yelling about taking medication, never ideal, and pleading with your child to take the medicine. Also trying to frighten your child with scary medical outcomes, this something horrible is going to happen. You're going to end up in the hospital. You're going to have surgery. Who knows, things that are really going to scare your kid. Not really helpful. And holding your child down and forcing medication into their mouth, of course, is never ideal. None of these things are helpful, and many of us have done them and not with great success. But there are other choices, and that's really why we're here today. Learning how to understand your child's individual difficulties with medication and ways to address those difficulties will help your child feel proud and self-confident, develop a routine tailored for your child and for your family. And of course, that will reduce stress in the family and, of course, improve health outcomes if they're taking their medication as recommended. So what you really need to find out is, why is your child having difficulty? You really have to do an assessment about your particular kid. Is it because the medicine tastes bad? Does the child have difficulty swallowing if it's pills? Are they tightening up their throat muscles, for instance? Are they afraid of swallowing the pills? Some medications we know have side effects. And, for instance, if your child is gaining weight as the result of the medication they're taking and they don't like it, is that what's causing them to not take the medication? There are lots of requirements related to taking certain medications, such as having to take it on an empty stomach, and the child wants to eat and not take a medication on an empty stomach. There's also embarrassment or discomfort with others finding out about the medication or the illness. And of course, if that is the case, you need to work with your child to find a private way to take the medication. Needing a prescription refill, that's really usually the parents' issue. And, it's often hard for us to get to the pharmacy in our busy lives, or calling the doctor for a refill. But that's another reason that there's some difficulty. There could just be plain old forgetfulness, like your child is forgetting medication. And sometimes forgetfulness is actually denial, which is, I don't want to have this illness. I don't want to think I have this condition. And so if I kind of think I don't have it, then I really don't have to take medication for it. Or they would rather do it their own way, their own particular way, which might not be exactly as recommended. And also there's fear or worry about the medicine, what it might do to them, what's inside of it. Kids have great imaginations, as we know, and sometimes they have some very interesting ideas about their medicine that we would never know if we didn't ask. And so the question to really ask your child to find out any of these things is, so what's making it hard to take your medication, right? Like what's making it hard? And you might be very surprised by the answer. And I'll pass it over to Elisa.
Thank you, Annie. So if the problem is worry, we really do want to figure out what the reason, as Annie stated, all of the reasons that might be present. It really helps to plan your intervention based on what you think the problem is. And before we jump in with some very practical skills building ideas, we want to talk about what to do when your child is worried about taking their medicine. Some typical worries that kids have are, what's inside it? What's it made of? Have they had a bad experience, such as gagging, feeling like a pill was stuck in their throat, vomiting, difficult side effects? Is that why they're worrying about taking their medicine? Some kids have physical problems or sensory issues that might make it difficult to take their medicine, and knowing those factors can help you design the best intervention. Sometimes they feel defeated, like they won't be able to learn how, and having some specific skills and strategies could be very helpful for that. And at other times, they're worried because they misunderstand what the medicine will do for them. Sometimes they don't understand that a medicine that takes a while to work is working. So we're all used to medicines like Tylenol and Advil that you take and you feel better fairly quickly. Some medicines take longer, and kids benefit from knowing that. You might not see it right away, but this is going to help whatever the medicine is going to help with. So when worry is the problem, what we really want to do is think about how they're thinking about it. So there's a big difference between the thought, I'm happy to have medicine that will make me feel better, will make my something work better, whatever that medicine's going to do, versus the medicine tastes awful, makes me feel bad, has side effects. Those are very different thoughts. And you're much more likely to be willing to learn a skill if your thought relates to the benefits of the medicine rather than the problems that you expect it may have, especially when those problems aren't really true. They're come out of, as Annie said, a child's imagination quite often. So we want to think about those thoughts so that we can affect the feelings and the behaviors. So how do we do that? That sounds pretty good, but how do we do that? So helping your child shift their thoughts about taking the medicine comes out of first finding out their specific concern and then sharing what the medicine is supposed to do. Honesty at a child's developmental level can be very helpful. Why are you asking them to take this medicine? Why does their doctor think that this is a good idea? Their doctor, even mentioning that their doctor has studied and has worked with this medicine before and that it's helped other children can be a useful thing to let them know. And discussing how learning a skill to take the medicine and being able to do it in a way that causes less of that desperation and distress and crying can make their whole day go better. And finding those moments when you can catch them being good, they've taken the medicine, it's worked, and you can say, wow, that was a very different experience. In general, it's better to take on a challenge rather than avoiding it. So, facing some of those fears about taking medicine and actually taking it might be better. So, if you sort of postpone, you say, I'd rather take my medicine after lunch as opposed to in the morning, you're better off not delaying, because in that entire time of delay, you're just worrying about it as opposed to the I got this. As an aside for everyone attending, the three of us and our guest speaker, Erica Lee, will be talking more specifically about how to help your child deal with worries about their medical condition in a wider way next week at the same time. So we hope if you're interested in this topic and your child has worries about their medical condition, not only taking their medicine, but also other aspects of it, please attend next week. We'll hear more. So another way to address those thoughts is to develop a story about taking the medicine. So the story that the medicine's going to help me, I was afraid, but I did it. I figured out a way to deal with the side effects, or my stomach hurt, but I took Tums, or whatever it is that you did, can really help the story and help them develop those healthy thoughts about it. So also identifying the story about the other ways in which they've experienced success in their life. I didn't know how to play basketball, then I learned to dribble, and now I really enjoy it. I'm going to do that with the medicine. It's just going to be something I do, and then I'll be able to go on with my day. Finding ways that the whole family can make medicine a positive thing. So if the family takes medicine or vitamins together before breakfast, this is just something we do. This is part of our family life, can also be helpful. So I'm going to turn it over to Gail in a minute, but this idea of it feels better when you have this skill. So that's why we're going to talk very specifically about the skill of taking your liquid medicine, chewable medicine, and in great depth how to learn to swallow pills. Because once you learn how, the process is easier. So again, as we talked about with the basketball, reminding them that they have learned other things and that this is something to learn that takes some practice. Doing it in a relaxing way is also very useful. And with that, we're going to get right into the practical piece with Gail.
Hi, thank you, Elisa. So we're going to start off with talking about young children, infants. And there are basically three ways to give infants medication, oral medication. So there's an oral medication dispenser, which is also called an oral syringe. It looks like this. It comes with Tylenol and Advil for infants. And you just you pull this up and get the medicine inside the syringe. It doesn't have a needle like you think of regular syringes. And the most important thing to remember with this is that you should place this, when you put it in your child's mouth, put it in the back corner of their mouth and then slowly push the medicine out. If you do that, it's more difficult for your child to spit out the medicine. It also, if you push it straight back into their mouths, they might gag on it and start to cough. So the best place to do it is in the back corner, either side of their mouth, and do it very slowly so they get a chance. You can actually, with infants, often see them swallowing, and so allowing them to swallow the sips of it as you squirt it into the back of their mouth, into the back corner of their mouth. Another way to do it is if your child doesn't mind the taste of the medicine, there is a type of pacifier that you can purchase that connects to the oral syringe, and your child can just suck the medicine out. So that's a very simple one to do if your child likes the taste. And finally, with the permission of your doctor, because we don't want to mix medicines with anything unless we know that it's not going to change the medicine, you can add it to, you can mix if it's okay with the doctor, you can mix the medicine with a small amount of either juice or their formula in a bottle that they're used to drinking from. The idea of using just a little bit is so that if you were to mix it with a full bottle and then your child only drinks half of it, then you don't know how much medicine they've gotten. But if you just put a little bit in, mix the child's dose in with it, and then they drink it, it's more likely that they'll finish it. And then you'll know that they've gotten their full dose of medicine. So that's for babies. Now we're going to move on to a little bit older children. Giving children control in general can help with lots of different things. And there's different types of ways to give your child control. We often talk about giving choices that are that you're happy with either answer. So, do you want red or do you want blue, rather than say what color, because you may not have the color they want. So one of the choices you can give your child, if they're old enough and they're cooperative, is to allow them to squirt the medicine in their mouth. And if they don't like the taste, you might consider allowing them to follow it with a strong flavored juice or sucking on a lollipop after, because that will get rid of the taste in their mouth and it won't be such an issue. And like a lollipop, it's also like a prize, because kids love the candy. Or even, juice. A lot of families minimize how much juice their child drinks. So that's another sort of perk the child gets. With the approval of your medical team, again, you can also mix medicines with different flavored liquids, and you can let your child choose what it is. And always remember to ask first, because there are medicines out there that cannot be mixed with anything. They have to be just taken with water. So you always have to ask your doctor or your nurse or someone on your medical team, but then giving your child a choice of mixing it with chocolate syrup or honey, or putting it in pudding or ice cream or something that they like, mashed potatoes even. And that again allows them to have control. So some children, taking liquid or chewables they don't like it. They don't like the taste, or they don't like the texture of the liquid or chewable medicine. One of my children had a very hard time with the texture of the thick liquids that some medicines were, and just couldn't deal with it. And she didn't like the chewable medicine either. So we talked about how the next step would be to learn how to swallow pills. And sometimes the strategies for taking the chewable or liquids don't work. So learning to swallow a pill is a solution for that. And some medicines don't come in liquid and chewable forms. So again, swallowing a pill is a solution. And lastly, some medicines you can't chop up and you can't crush. For example, extended release medicine is coated so that it slowly, when you swallow it, it slowly releases the medicine over, say, a 24 or 12-hour or 24-hour period of time. If you were to break it up, it wouldn't work the way it's supposed to, and you get too much medicine at one time as opposed to how it's supposed to release slowly into your body. So when you decide you're going to start to teach your child, you decide you want to try to teach your child how to swallow pills, there's some things to consider. So how old should a child be when they start to learn how to swallow pills? Typically, a 4-year-old can learn how to swallow them, but there are younger kids who are motivated to learn, and they can also swallow pills. I've taught pill swallowing to a child as young as 2.5, because I was also working with another patient who was 5 at the same time. They knew each other, and the 2.5-year-old was very competitive and wanted to be a big boy, just like his friend. And so he ended up doing it. He watched the 5-year-old, what he was doing, and he did it too. So it was pretty amazing. I'd never seen that before, but this 2.5-year-old did learn how to swallow pills. But it also takes motivation. As I said, this little kid was very competitive, and he was motivated to learn because he wanted to be considered a big boy. So your child needs to have motivation and is willing to try to learn this skill. And ideally, you also want to try to teach them before they need to know, because the pressure of having to swallow a pill when you have to do it for your health is a lot of stress on both the parents and your child. So there are several things you can do to sort of set up your child in terms of their thinking. One is to be a role model, and other people in your house as well. So if you or some of the other children in your house know how to swallow pills and are taking medicine, taking it in front of your child can show them that it's a very common thing for people to do, and that it's not a big deal to swallow medicine. Also reminding your child that they've learned to do things in the past, and it took time to do so, but they did. So like riding a bike, they didn't just jump on a bike and start riding it, or they didn't jump in a pool and start swimming, or start reading right away, or knowing how to do math. All these things are things that you learn, and swallowing a pill is also something that takes time and it takes effort. And as a parent, it's important to be both optimistic and encouraging that your child can do this. Now, again, giving control is important, as we talked about. So there are all different ways. Another way to give control over teaching pill swallowing is to start off with letting your child decide what are they going to try to swallow pills with. So there are all kinds of choices out there. So I actually went to a local party store. I found an Olaf drinking cup. I also found a superhero, which you can also talk about how your child will be a superhero if they learn how to swallow pills. There are really fun straws. They're called silly straws that you can get. And then, of course, just the typical water bottle. I have one of those as well. There we go. So sorry about that. And here's a water bottle. Sometimes one is easier for your child than the other. So having multiple options available to your child is very helpful, because some kids do better drinking from a cup, others do better from a bottle, and others still do better from a straw. So staying positive, again, is through the whole process makes a giant difference. And I can't emphasize this enough. Giving your child positive feedback, giving high fives, saying good job, offering small prizes. They don't need to be physical prizes either. It can be that you read an extra book before bed, or you take a walk to the park, or do something fun, play a game with your child after they've tried for a while. And it's important to try to have your child to keep trying. And also, it's okay to spread out the sessions so that they become comfortable swallowing pills. Congratulating your child. I can tell you're trying really hard. You can do this. It just takes practice. I'm so proud of your efforts you're making. Those are all great things to say to your child when they're trying to do it, even and especially when they're not being successful at it. They need to know that that's okay and that you're still proud of them just for making the effort to learn. The other thing that's helpful for both you as a parent or caregiver is to take a break. And it's helpful to your child also. So if you feeling yourself getting frustrated, or your child getting frustrated, or they're getting filled with water because they are drinking a lot trying, it's time for a break. And you can say, you know what, we're going to take a break now, and we'll try again later today or tomorrow. And lastly, to keep the practice upbeat, even if your child has not accomplished what you're hoping they do, to always be positive. We want this to be a fun and good experience for them, because otherwise they're not going to want to keep going. So we want to continue until they've accomplished their goal. So when you're choosing we're going to talk about different options for teaching your child to swallow pills and what kind of foods and candies they can use. So the first thing you want to do is think about what you can use with your child, depending on their allergies and your cultural needs, and consider the size of the pill you're taking. So whenever I've taught children how to swallow pills, we start off discussing what is the medicine that the child needs to take. So say it's an Advil, I compare that to a size of a candy. So that's a little bit larger than a mini M&M. So the goal would be to learn how to swallow a mini M&M, and then maybe something a little bit larger than that. And some kids are concerned about gagging or the feeling of the pill going down. So another approach is taking a mini marshmallow and cutting it into small pieces and trying to swallow those, because they're soft and mushy and you don't get a sensation at all from swallowing those. Now, this is a lot of information, and I'm going to remind you again that at the end of our talk, there's going to be a QR code that has all the information about teaching your child how to swallow pills, and this, as well as the many of the other slides and information, are included in that booklet. So we're not endorsing any of these specific brands of candy, but these are ones that we've used successfully in the past. So what the idea of the pill swallowing, to teach your child pill swallowing, is to start with very, very small candies and gradually move your way up into larger sizes, again, that match the type of medicine that your child needs to take. So I typically start with Nerds. And, it's Halloween time, so candy comes in all kinds of little packages. These are little Nerds. There's M&Ms, Skittles. These all come like as a Halloween giveaways. If you choose these to give away from your house, then you can pull a few aside for pill swallowing, or after Halloween, everything goes on sale. So it's also a great time to buy these candies so that you can work with your child. But with the Nerds, they come in so what I do with the child is I have them spill some candy on a plate, and I say to them, pick out the smallest Nerd you can find on the plate. And then what we do is gradually, once they've learned to swallow the Nerds, we move on to larger candies. Alternatives to, so other candies, so say your child has a nut or dairy allergy, there's other candies that they can choose. So mini chiclets, which are these tiny pieces, they're actually gum, but they come in a pack like this. Or Smarties is a candy that can be substituted for like a mini M&M. And then also there are cake decorating packets that come in all different sizes, and these could be also purchased. This actually has almost all the sizes you'd need in one box for teaching pill swallowing. So these are some suggestions of what you could purchase to use for pill swallowing. Now, if your child has to limit the amount of sugar intake, there are many alternatives available as well. And if you Google sugar-free candy, various things come up. Russell Stover makes a sugar-free candy that's similar to an M&M size. Jelly Belly makes their Jelly Bellies as sugar-free as well. There's a company called Chalk Zero, which makes marshmallows that can be cut up, as we talked about. If your child needs to start with marshmallows and needs it to be sugar-free. So remember, there's all kinds of options out there. And then there are some families that really don't want their child eating candy, and we appreciate that. And there are healthy food alternatives that can be used, such as peas and lentils and beans and rice. The important thing, and couscous is also great, a type of pasta. But the important thing to remember is these should be cooked, and you should also try swallowing them themselves. Try to swallow them yourself, because sometimes if they're overcooked, they're too mushy, and then that wouldn't work well. So it's sort of, you have to sort of experiment with how to cook them so that they're the right consistency for learning how to swallow pills. And also a reminder is that our last slide shows the sizes of the candy. You can use this as a basis on the size food you're going to use. If you're going to cut something up, how big should it be so that it isn't a choking hazard for your child? So you and your child should choose a quiet space and a comfortable place to work on this. And as we talked about earlier, this should be a place that your child can have some control over. So discussing with them, where would be a good place? Where would they feel comfortable practicing? Again, letting them choose a cup, bottle, or straw, or having all of them available with you when you set up your time to try to swallow pills. And also having your child think about drinking water in different ways. So one thing I've told kids is to imagine that they've been outside playing and they're very, very thirsty, and they come in and they just chug their water down. And all kids have experienced that. They're just sweating and they just are so thirsty. They take their water and it just goes way down quickly. And that's how they should try to swallow when they're trying to swallow a pill, because that will wash it down right to the place that we want it to go, right into their stomach. Sometimes telling a child to count to 3 as they swallow. So they take 3 big sips and then count to 5. So practicing swallowing water is kind of the first step to teaching them to swallow the candies and increasing the sizes. And also another way to think about it, for your child to think about it, is that here's a diagram. If you put a candy back here and drink the water actually works sort of like a waterfall and carries the medicine down to your child's stomach where it needs to go so that it can start to work. And here's a waterfall. Here's an image of a waterfall with the same idea, that it carries things down into what would be the child's stomach to be able to start to work. So another thing that children always say to me when I've tried to teach them is that the pills are too big, the candy's too big, I can't swallow them. So one of the things I've talked to kids about is the fact that when they eat food, so they take a big bite of a hamburger, their teeth and their tongue work together to chew it, and then they form a ball in their mouth, or bolus, which they swallow. And if they think about what next time they're eating dinner, how big that ball is, it's much bigger than the medicine that we're asking them to take. So, and they also reminding them that it happens naturally. So it's not something they think about, but they actually do swallow things significantly larger than the pills and the candy that we're asking them to swallow. So we're going to talk, oops, sorry about that. So we're going to begin talking about how to the whole process of teaching your child how to swallow the candies to learn how to swallow the medicine. So again, I mentioned you start with the smallest nerds in the package and you let your child pick the smallest one they can find. You tell your child to place it on the tip of their tongue and then to push it back further, and then take a large sip and let the liquid wash the candy down the back of the throat. Once your child has done it once, it's very, very exciting, and the temptation is to continue to move on. But sometimes they just do that. It happens and they can't do it again. So it's important to have your child to do it 3 times in a row, 3 consecutive times with the size before they move up to another size. So I have children swallow the tiny nerds 3 times in a row before they can move to the larger nerds. And if they do 2 and then they have trouble, we start again counting back at 1. And I tell them that in advance so that they aren't disappointed. Before we begin, I say we're going to have to do these 3 times in a row before we can move on to the next size. And many children benefit from what I found from a pill swallowing success chart, which is this. And you can adapt this to whatever candies your child needs. This is just I copied and pasted photographs of the candies and they are increasing size, put boxes to check it off. So they start with the water, then the small nerds. And this allows the child to see their progress and see that they're improving. Also, the other thing I've done is if their goal medicine is the size of a mini M&M, I'll circle that when I'm working with them so they know this is what their goal is. Although I must say that it's great to get to that goal, but it's also important to continue maybe at a different time, a week later, whatever, to keep going to larger sizes, because at some point in your child's life later on, as they get older, there will be larger medicines to take. And if they learn now, it's easier than when you postpone it to a later date or to when they have to learn, as we talked about before. So there are things that I've seen children do that make it hard. Some children will put the candy in their mouth, take a sip, and then start swishing it around. They go with their mouth. And I always talk about that they're letting a boat float around in their mouth. The candy's actually swishing around like a boat or a fish, and it's not going to go down because it's now, sometimes they get caught, behind their teeth and their gums, and it's not in the right place. So we talk about that it really is important to do it step by step, to put the candy on their tip of their tongue, push it back, and then let the water flow down immediately and not stop and let the water swish around and not play with the candy in their mouth. Some children want to rush to do it because they're not being patient. And again, it's important to remind them that this is much easier and goes much quicker if they do it slowly and step by step. Put it on their tongue, push it back, and then take the big gulp of water. So there are some tricks to making it easier. Remind their child that when they swallow the liquid, it actually may surprise them that they don't feel the candy. I've worked with some kids who will open their mouth and say, did I really swallow it? I didn't feel it go down. And in fact, they did, because the water just washed it down and it just went down, and they're so surprised. Praising your child, again, can't emphasize enough how important it is to praise your child for trying. There are people who teach pill swallowing, suggesting that kids try different head positions. So instead of just drinking and swallowing with their head forward, either to the side when they're swallowing, either to the right or the left, or their head up or down, because that changes the way their throat shape is. Turning to the side supposedly makes their throat a little bit larger, and so that it's easier for it to go down. Taking breaks, as we mentioned, is very important for both you as a caregiver and for the child, because they do get a stomach full of water, and at some point they're like, they just can't drink anymore. And then, of course, when you swallow candy, you don't get to taste it because it goes right down, just like you don't taste medicine. So for fun, I always try to let the kids take some of the candy to eat. Sometimes if they're trying to swallow it and it's starting to dissolve in their mouth, I'll say, oh, just go ahead and eat it. Sometimes I'll say, okay, when we finish the 3 in the row, whatever's left on the plate, you can eat. Sometimes they can taste it before they start. You know your child best, so you can decide with them how you want to do that. But that reinforces them a lot as well. And then staying positive can make, again, I am emphasizing this so much, can make a big difference. And staying calm, even if it's not going well. Some things don't go well, like kids when they're trying to ride their bike, they'll fall and they'll cry. And if you say, okay, don't bother doing it, they'll never learn to ride their bike. So it's important to say, you know what, you tried, and you can get back up and you can do it. And the same goes with practicing swallowing pills or candy. and giving high fives and verbal praise and small rewards. As I mentioned, they don't have to be things you buy. And to keep trying. You can have multiple sessions and try to achieve, like, just trying to get through the smallest nerds. And even if it doesn't work, say, okay, we're going to stop for today. Congratulating your child for trying, keeping the session fun, whether your child accomplishes the goal or not is important, because you want them to go back and do it more. And again, reminder is to let your child have as much control over the situation as they can, because if they feel like they have control, they will do much better. So in summary, believe in your child and believe in yourself, and you can do this. So after they learn to swallow pills, and I'm going to be very optimistic about this, that they are going to learn how to swallow the pills. The next step, and actually this is important even if they're not swallowing pills or if they're taking chewable medicine or liquid medicine, having a way, an organization for taking their medicine is so important. And that way they get used to doing it as a regular routine. If this is a medicine they need to take every day, and you can set it up so that it's associated with things that they're doing during the day. So for example, it can be that the medicine they take when they're brushing their teeth or when they're getting ready for bed. I personally take medicine after my breakfast, and I have 2 trays of medicine, one that I keep on the kitchen table that I take. I don't have any children around, so it's okay, that I take in the morning after my breakfast. And then I have another tray that I take before bed, and I have that in the bathroom so that I take it before I go to sleep and I don't forget. Keeping a progress chart or a reward chart or a schedule like this one, and that the child checks off that they've done it, can be very helpful too, and rewarding in itself, just being able to check off what they've done for the day. There's also checkoff charts that you can, this kind of thing you can buy at any, like Staples or any office supplies store. They sell things like this. You can put stickers on it, and it just can be that, they did it today, so good for them, and they get a sticker. This type of chart we can get to you if you'd like a copy of something like this, where the child puts a sticker on the paws as they accomplish, like if they take their medicine in the morning, they get a sticker, and then in the evening, and they keep going. And then when they get to the brown paw, they get some kind of small prize. And then this is just a very simple chart where the child can just draw a picture. The caregiver can draw a picture in the square when they've done something that's been helpful. And it can be for taking medicine, but it also can just be, this one was made, I help my caregiver take care of me chart. So this is just a very general one if a child cooperates with whatever they need to do to stay healthy. And now Elisa's going to take over.
Oh, I think it's me.
Oh, I'm sorry.
Okay.
Annie's going to take over. My mistake.
That's okay. We're a team. So the other thing is to acknowledge that some children are just not ready, that you try this and you're optimistic, and most kids will learn, but some children are just not ready for pill swallowing. So they'll need to wait until they're a little older or a little more mature to learn the skill. And you can let them know that that's okay. Sometimes you might need to consult a mental health professional. So consider involving a mental health professional for your child. For instance, if your child is very anxious about new medicines or new experiences in general, or had a really bad earlier experience like gagging or vomiting when they tried to swallow a pill and just is not willing, is drawing a line in the sand and is not willing to learn to try because they're too scared. Or if your child has developmental delays or oral motor problems such as speech problems or oral sensitivity, or a hard time with some tastes or textures of food. And also, if your child has some behavioral problems, which could include refusing to take any medicine, it could be refusing to do all kinds of things, and medicine is just one of those things, really consult a mental health professional. And you can talk with your child's medical provider, medical team, if they have one, to see if they have recommendations for mental health professionals who they work with. And this is the slide. We have some resources for you, but this is the slide I talked about at the very beginning about how you can access the pill swallowing guide that we've put together, teaching your child to swallow pills. And you can use the link, or now with your phone, you can scan the QR code. It's about 4 pages that looks, I think it is 4 pages, that looks very much like what you're seeing on the right-hand side of your screen. It's very simple to follow and very straightforward, and we hope will be helpful to you. And we just want to say thank you so much for coming today. I see we have one question in the Q&A, and if anybody has other questions about what has been presented today, again, it was a lot of information, but we hope it was very, very clear and straightforward. We have one question to start with, and it's really important. Advice for kids who are intellectually having challenges or minimally verbal, when they don't understand why they need to take the medication and can't express why they don't want to take it, and they just go into like the fight, flight, or freeze mode. It's a really great question, because we said ask your child about what makes it hard to take medication, and if your child is not verbal, that's going to be harder to assess. Elisa and Gail, do you have any input on this particular question?
Wow, what a great question. I don't know. I have some ideas. I don't know if you do too, Gail, so jump on in. But what I would say is this, that you've hit 2 things that are so critical that we've been talking about as a team. One is how to communicate with kids who have more challenges in communicating. And that is really on our radar, to just think about that more widely, and to think about how to engage kids when they can't always tell us what they're experiencing. So hopefully we'll come to more on that. And also how sometimes when you're anxious, you can't even know what you're upset about or express it, even if you had those language skills. So this is a really important question. What I would say to you is, what you might want to think about is pairing, and also sort of your own educated guessing about what's going on. So if you say to your child, okay, time to take your medicine, and they start screaming, crying, you see what you've really nailed it with the fight, flight, and freeze. They're going to either run away, they're going to push, they're going to just be immobilized, none of which really contribute to being able to take your medicine. So those things make it much, much harder. So couple things here to think about. First is how do we reduce their overall anxiety about the medicine, and how do you guess what's going on with it? So when kids don't have language, we can sort of say, is it always at this particular time? We can start to make educated guesses about what they're anxious about. Maybe it's just that contagious anxious, because you're anxious about giving them the pills. Maybe they're anxious because they don't know how to take the medicine, or maybe we don't know why they're anxious. But I'm trying to make those guesses. Is it the time of day? Is it something about the medicine? Using your own observational skills when your child can't tell you is a first step. Second step is trying to think about an exposure hierarchy for taking that medicine. So let's say it's a liquid medicine that you're having trouble and your child is having trouble taking. So the idea of having them be comfortable seeing it around. So you could make, but we're going to talk more next week, so I'm sorry to keep plugging that, but we're going to about how to develop a hierarchy. So let's say it was a liquid medicine and they start crying and don't want to take it. Could we get them to have the medicine in the room while they're watching a favorite show or while they're playing? Can they even just tolerate having that medicine near them? Can they, how do you get them to have a greater comfort with an easier task than taking the medicine? Might be something to think about if they're very anxious about it. The second thing is how to think about engaging relaxation skills and lowering their overall thermostat about it. Like, so I don't know if you come at them and they're in an anxious mode, that's going to make it harder. Are there things that have them more relaxed? Are they listening to music that they like? Does it follow playing with toys that they really enjoy? I'm not sure if that answers, but I think that being that detective about what is it that you guess that they might be anxious about, and starting to build the skill when it's easier, just as we're talking about trying smaller pills before you build up to the bigger pills. So it's trying the smaller task of how do we get them more accustomed and more successful with the medication even before taking it. Sorry, that was a long answer. I don't know if either of you have anything to add.
The only suggestion that I have to add is that it might be something that you would want to see if it's okay to mix it into something that your child likes to eat. With you, again, you need to check with your medical team if it's a medication that's okay to do that. I would not tell your child that you're doing that, because you want your child to know that you're honest with them, but that might be a method of getting them to take it. Say they like ice cream, to, either have them take it mixed into the ice cream, or have ice cream afterwards, so that it's something is positively associated with it. If you can't mix it in, or they don't want you to mix it in, if they've communicated somehow that that's not acceptable to them.
I love that whole idea of pairing. So making something good come from it at the end. But even if you made a whole nice experience as best you can, like starting it at the start with, like, you mean even have ice cream at the start, the medication with or without that ice cream, and then afterwards, let's have it just shift the experience. Because like we all know, just as Annie was saying at the start, I mean, all three of us know that giving your kids medications when they don't want it, it's stressful for us too. And we have to sort of take care of ourselves when we're doing that, because we know that medicine is so essential for our child's well-being. And the idea of not being able to get it to them is also stressful for us. So trying to make it a pleasant experience for the kids all the way through, as well as for ourselves, as best we can. Eat some of that ice cream yourself, and eat some of that candy too,
That,
if it's healthy.
that's exactly what I was going to say. And we have a couple more questions here, but I do want to say, we say in many of our presentations about anxiety, that parents, we have to check our anxiety first, because it's contagious. And to just take a beat and a breath before you enter the situation. Often we're in a rush and we want to kind of get to it. But really to kind of think of ourselves and find the ways that we calm ourselves before walking into the situation with the kids. So there's another question here that says, how do you help a child understand that a certain medication with severe side effects, for instance, chemo or high dose steroids, are actually helping them? It's always so challenging to help children of most ages take those medications with such awful side effects and that make them feel sick, right?
Wow, we have a wonderful audience today.
We
What
do.
a great question. And that is really challenging. And I think probably we've experienced that ourselves, where we didn't want to take a medicine that was going to have side effects. I have a friend who was going to get a vaccination last weekend, and she was so afraid because she was so worried about the side effects. So we say that's true about kids, but it's also true of all of us when these medications have side effects. Balancing and understanding what those side effects are. I want to say, first of all, to take into account your child's developmental abilities, their ability to understand what's going on, and their cognition about it, and their age also. And I've seen this a lot with kids, and also explaining that some medicines can affect your mood. Because sometimes I had a child who I was working with, who was taking steroids, and it really affected her mood. And just even understanding at times, okay, that my mood is affected by the medicine. That's not a long-term thing. That's because I'm taking this medicine. If it is a short-term thing that they're taking that medicine. I think the first thing is honesty. And I think you can't pretend that medicine doesn't have that side effect, but even your own reasoning about why it's still important to take it and what it's going to do in the long run. What I was watching some videos this weekend about medical trauma, and where they were sort of talking about the impact of kids think about when they feel upset about medications and interventions, they think about the short-term problems, as opposed to parents that think more of the long term. So kids are more worried about like, what is that short-term impact than the long-term impact of benefits. So I think even really reminding them, okay, you're taking this, it makes you feel sick right now, but here's why we're going to do it and how it's going to help you in the long run. And then pairing that also with, and what are we going to do to get through this hard time with that side effect? And having a plan about that. And saying, okay, so it makes your stomach upset. What are we going to do about that? How are you going to distract? How are you going to feel better about that? Knowing that you're the kind of person who takes care of your health and you're brave, again, depending on their developmental level.
And also just acknowledging the fact that you understand that it's not an easy thing to do. That, you know, as hard as it is, the idea of the medicine is that they're going to get better and they won't have to take this forever. The goal is that they become healthy again, especially with things like chemo. You know, it's so difficult to go through, but the end goal is that they are then healthy and can go back to their normal life the way it was. And just acknowledging the fact that they're having a hard time, and that you understand how hard it is, can be helpful.
Whatever that improvement it is, you sort of think to yourself, what's the reason why I'm asking my child to take it? And what's the reason the doctor is that, and having it at their level as best you can with the plan about why and what you're going to do to make it as good as it can be, whether long-term or short-term for the medicine.
I think we have 2 minutes left, and one comment that I would like to share with everybody, and I believe this is a wonderful staff person here who is commenting, who said, creating a social narrative or social story. We talked about using pictures and simple language to break down the steps could be really helpful. I think this is really regarding a child's understanding of what this is, and that we often use a lot of, it says a first then language and offering a preferred treat activity right away. But thank you for bringing up the social narrative and the social story. And Gail, I don't know, can you say any more about that for 1 minute?
Just that's a typical way that staff who work with children with autism will use what's called, so people who have children with autism often will know about the first then language, but the idea is to say to the child in very simple terms, first we sip the medicine and then we lick the lollipop. So it's very simple and straightforward, and it lets them know what the steps are to get through this.
I want to also add in, if you make that story and you ask them to model for pictures and you make it a picture book of them, they will actually do a lot for that. They, here's you. And then it also has that idea of yet, as opposed to I can't. So I can't take the medicine. I can't do it yet. And we'll put the last picture in when you've learned to take your medicine, and we'll add that to the story at the end of it. The idea of what we're going to do. Kids love a story about them with photos and make it that social story like Gail and Teresa are talking about. So thank you.
I see that it's 1 o'clock. We had one last question. I don't know if we can answer it here, but I want to put it out there, and hopefully we'll be able to include some information maybe when the recording is sent. But are there any good children's books with characters taking medication? So
one doesn't come to mind for me, but I wonder if some of the Doc McStuffin ones might have that. I would imagine it would, and it might be embedded in some stories that we have from the from the whole company of the Mr. Rogers company that makes a lot of good books about medical.
And if there, I don't know of any either, but if there isn't, this is an opportunity to
good idea, whoever had that idea.
Yeah, it's a great idea.
Well, we want to thank all of you for coming today. We're so glad you did, and we hope this was very helpful.